Hello, respected members of the organizing committee, respected members of AOP, Ahmedabad, Gujarat, all my friends from across the country, respected chairperson and my friends in the audience. Generally, which may seem sad, but if you navigate it correctly, all grief leads to happiness. And especially when we are dealing with grief related to the passing away of somebody beloved, it is something which is very, very emotional, which is very, very close to all of us. And even the discussion of this may elicit some trauma in some of us in this audience. So I beg pardon for that. And if I can support anybody after the session, I'm more than happy to do that. I'll start with my experience in this really increased during the COVID times, as it must have been with all of you. There was this call I received from a 12-year-old's mother in the COVID lockdown. The grandmother was admitted, child was at home with the father. The grandmother was brought home, and the father developed a cough, said he was going for a day or two just to be careful, told his son not to worry. So the father kept worsening, but kept calling the child on phone, "Arey, kuch nahi, sab theek hai." And I'm sure many of us may have met a situation like this during COVID. 2 days later, the call stopped. 3 days later, the father passed away. And the mother called me frantically, not knowing what to do, because the child kept insisting that when my father never ever lied to me, he said he'll come back in 2 to 3 days. Why is he not come back? Then there was this child, I've written Narendra because a friend of mine, dentist, he had two kids, 13 and 7 years, and both husband and wife are dentists. So 24 hours full-time practice. Kids literally grew up with his mother. And the mother died after a brief non-Hodgkin's or something, and she died. And the children stopped eating, were gloomy and crying often. And he called me up. And the real reason was that they only used to eat with her. And the fact that she was not around, they just would not want to eat at all because there was so much of association with that entire thing. Then there was a friend of mine. She is a friend of mine from Delhi, development pediatrician herself. A family friend of hers, close friends. Both parents were doctors. The guy was a cardiologist himself. He had a sudden MI and passed away. Mother was completely devastated because they were already bringing up two children who were adolescents who were with autism and needed a lot of support. The kids became belligerent, aggressive after this happened. And my friend called me saying that everybody is very worried because सब relatives घर पे पहुंचे हैं, सब रोना धोना हो रहा है, but the boys have not cried. So the call to me was, can you make them cry? And I had to explain to her that it's not necessary for anybody to cry to be relieved. वो बोलता है गम दिखना चाहिए, गम बाहर आना चाहिए. So all that actually they needed was because of all this disruption, they were used to playing Satish bhai video games for about 6-7 hours every day. तब वो बंद हो गया. So they were very aggressive and belligerent about that, and not necessarily that they really understood, in spite of the fact that they were 13 years old, about the grief and bereavement. And it only required to get them back to their routine that really helped. This is another pediatrician friend of mine. His wife suddenly passed away, and now he had an older child who was in college and the younger girl who was a teenager. The man literally had to change the entire work schedule and everything else because now he has to be at home being a mother to the child and being able to take care of the child. So death brings so many unfortunate, unforeseen situations beyond the death of the person who has passed away. And we all know this Kubler-Ross grief cycle, I'm sure we are aware, where she described that there are stages of denial, then anger, then further you get worse when it gets to the depression part. Then you start to bargain, learn, अच्छा ठीक है ऐसा भी होता है वैसे भी हो सकता है. Finally you accept and you move on. I'm sure all of you have seen this and it's absolutely right. What I'm not very happy about with what the system, the Western system is, because I saw many of us supporting Western guidelines and Western data. Nothing wrong with it. The data is perfect. But let's please understand that the emotional issues and mental health issues are dependent a lot on our culture. And hence, blindly adopting something which may be A grade evidence in the US may be evident, but it is not, may not necessarily be of help in India. And here is the line itself. So what do they say? When people are going through denial and anger, what do you give them? Information and communication. मतलब you tell them it's okay to feel like this. इसके बोलने से किसी का दर्द कम नहीं होता है. So what I'm trying to show is that Kubler-Ross and her cycle may be appropriate for an American culture which is a little bit distant anyway, or a European culture which is a little bit anyway. But a pediatrician here tries to act distant and says that I will provide you information, please pick up a few brochures and look at it. It is not going to be appropriate in our Indian system. Why? Because in India and everywhere else, the
Hello, ma'am.
belief and practices are very, very topical or regional or
Hello.
local. Now look at it how we look at that. Some look at it, अरे उधर मैयत हो गई है, उधर मत जाना. Some say अरे ऊपर वाले की मर्जी, क्या हुआ कोई बात नहीं, चलो उधर जाते हैं. Some believe in afterlife, some don't believe. Some believe in paradise, some believe in rebirth. There is all this concept, अरे आत्मा तो अमर है, बदन खत्म हो गया है. Then there are rituals. Sometimes I remember when I was a child, 40 days those rituals used to be going on every evening. खाना बन रहा है, पकवान बन रहे हैं, सब ऐश कर रहे हैं except the person who has passed away. But I don't wish to make fun of what my own rituals or something I saw. This is what is prevalent. And fact, fables like, no, don't worry, Dadaji has not died, he has gone up and become a star. Every evening this child is looking up. ये वाले दादाजी है, पड़ोस वाले दादाजी है. So all these things keep happening. But in all this, what gets forgotten is the trauma. And nobody really understands and appreciates that children may be getting traumatized. But what are the factors that affect the bereaved? Age. Obviously, if you are a 7-year-old child compared to a 3-year-old child, the way you are going to be affected is very different from the way a 12-year-old or a 17-year-old, because of your own processing of the information of the loss. It varies from gender to gender because males are expected to be more stoic boys, whereas the girls are expected to be crying and inside the kitchen cooking food for all these 40 days for the relatives who have come. The relation with the deceased is very important, whether it is a father or it is a mother or grandmother or a sibling or a child. Where we are talking about adolescent, so with a sibling. But it's also important what was your relationship with that person. If it was your father and you probably hated the guy, I mean, you may feel something different. You may feel guilt that you didn't really patch up with him. But if it was a father you really, really loved and you did everything for it, you may feel a different kind of sorrow. Of course, the family dynamics matters probably the most. And the speakers before me also mentioned that it's the family that matters the most. How good are the family coping mechanisms for any trauma? You can't suddenly now begin to bring a new module. No. Till yesterday we hated each other by sight. Everybody wanted to kill each other. Then one person actually died, not because he was killed. And then suddenly they all adopted the module given by American Association, and we adopt that module in a Thai. Nature of death is very important. Whether it was a sudden death, whether it was a prolonged illness, whether you knew something was going on or no. And hence, sudden deaths like a cardiac arrest in an otherwise healthy person or a trauma, road traffic accident is far, far more difficult and different from somebody who has a malignancy which is going on in and out of hospitals. Some way or the other, nobody is anyway ever prepared for a loss of a dear one. But in your mind, it's somewhere that's going on. Nature of death, which you mentioned, belief system, again the religious cultural systems, what we believe. And sometimes it may be unfortunate that there's a car accident and you lose 2 or 3 members of the family at the same time, or in situations like natural disasters like a tsunami, or even in riots and so on and so forth. The most important part of the clinical features, they manifest in unexpected ways, from irritability, withdrawal, aggression, academic decline over a period of time, if not immediate, risk-taking behaviors, substance use. What I've put in yellow is my own feelings about it or my own thoughts. The rest are literature based. Suddenly you will find this adolescent being either hyperactive or hyper mature. Now he suddenly feels he has to take care of mummy, or hyper accountable. मेरे बहनों का और भाइयों का सबका मुझे ख्याल रखना पड़ेगा. And the child starts being like that because all the relatives come there and say, अब ना तेरे को सबका ख्याल रखना पड़ेगा. So there is no time to process this grief, and hence children may oscillate between appearing unaffected and suddenly breaking down, exhibiting despair. This can be confusing for families as well as doctors. And hence what we must understand is it is never an individual problem, it is the family that grieves, and hence we have to be able to address all. And please remember, or let's recollect that grief can hide or present itself, hide for months, for years before it can come out, and present itself in more ways than one can imagine, and completely unpredictable. So look at the parent. When we look at what the parent is going through, what are the griefs of the parents? And I am reminded of this wonderful song which is actually a ghazal which says, kabhi khud pe kabhi halat pe rona aaya, बात निकली तो हर एक बात पे रोना आया. The mother who was lost, or the wife who has lost her husband, she is not only grieving about the loss of that person, but it's also her own loss. She now has to face a world without a partner. That itself is a problem. And then the more you talk about it, she may not be even aware in acute stage, but people talk, and suddenly one by one she may remember what are the challenges she has to face. Then it seems after a long day, some days later, you may feel, okay, now I'm okay with it. Suddenly one day कुछ बात याद आती है about the deceased, and suddenly you burst out crying. So हम तो समझे थे कि हम भूल गए उनको, क्या हुआ आज, ये किस बात पे रोना आया. And finally, किस लिए जीते हम, किस लिए जीते हैं, 12 ऐसे ख्यालात पे रोना है. So then you go into this phase where you are just wondering, why did this happen, why did it happen to me, self pity, understanding. And of course a big salute to Sahil Udyanvi, who wrote this wonderful song or ghazal, as you may know it to be. But the adolescent also has to go through a lot of grief and a lot of issues. And please understand, grief is not just sorrow for yourself. And hence, that line from that song is very, very important. कौन रोता है किसी और की खातिर है दोस्त. Not even for the one who has passed away. कौन रोता है किसी और की खातिर है दोस्त. सबको अपनी ही किसी बात पे रोना आया. And the child is thinking कि अब मेरा क्या होगा. I am 13 years old. Daddy had said he's going to send me to an American university and pay the fees. Who is going to pay the fees? This house is on rent. Father used to earn the money. Mother is a housewife. Am I going to be out of this house? Why am I saying this? Because American guidelines may not understand this. This may not be the situation there. They may not have a problem with unemployment or some financial issues. But our children are more worried. This is the reality. And that child will never open up and tell you all this. Threat to significant others. Children very often wonder, daddy के साथ suddenly cancer हो गया. Cancer family disease होता है. मेरे मम्मी को भी होगा. He doesn't understand कि heritability, the mother and father were not related by birth. But now he's worried, what if my mother passes away? And what if the mother is a patient already and suddenly the father dies? Compound loss. What else will be affected? The father has lost a job. Now you have to vacate the government quarters that you are living in. Loss of routine for the life, loss of privileges. My father was a big IAS officer. अब कौन हमें पूछेगा? So fear of change is the biggest worry that is plaguing the child. So the first thing we have to remember is inquire. How was the child? What was the child like before the event? What was the child's developmental history? If he was already a child with a developmental problem, it's going to get worse. Was it a dysfunctional family to begin with? Were there previous traumas? Grandmother passed away 2 years back. Before that, grandfather had passed away. And I'm not joking, before that, the favorite pet dog of the family passed away. It is equally traumatic for persons who are attached to their pet so much. And how did they handle bereavement at that time? Relationships amongst the people. Inquire about the cultural grieving practice. Oh, this child has not cried. Said he doesn't need to cry. And you don't need to call me to make him cry. But let us know there is a ritual and customs in some parts of our country which is called Rudali, where people are actually called in to cry to make the others express their grief. But don't believe that just by crying your grief gets down. Now this is a very nice song called Calm Down. Have any of you heard of it? I'm listening to it on loop nowadays, and you know why. So calm down. Do less than more. Everybody is hyper. अभी ये बच्चों के साथ हम क्या करेंगे? भरद्वाज जी, आप सबसे ज़्यादा स्माइल कर रहे हो. Very good. आपको मेरा दर्द समझ रहा है. Ask about the child's behaviors. कर क्या रहा है बच्चा? Okay, he's not crying. ठीक है, but what is he doing? No, he's gone back to his routine. He's going back to college and all is fine. Okay, ठीक है. नहीं, वो 3 दिन से रूम कमरे के बाहर आया ही नहीं. आस्क अबाउट एक्सपेक्ट. आप क्या समझते हो बच्चा 2 दिन में जाके अभी तो हो गया ना, हम लोग हैं ना बच्चे के लिए. वो फादर गुजर गए तो क्या हुआ, हम तो चाचा मामा तो है ना. दिस योर एक्सपेक्टेशन. द चाइल्ड शुड नॉट फील बैड. द व्हाट आर द एक्सपेक्टेड चेंजेस इन द चाइल्ड्स लाइफ दैट यू वांट. एंड मोस्ट इंपॉर्टेंट, मेंटेन स्टेटस को. नहीं रोया ना, कोई बात नहीं. डोंट डू समथिंग ड्रास्टिक as far as possible. For the adolescent, what will you do? Be natural. When you're a you're a pediatrician or an adolescent expert or anybody who's been called, even in your neighborhood, the child understands death but can't deal with the emotions associated. So what do you need to do? You just need to offer a rope that the child can hold on to. So show that you are somebody non-defect. अच्छा बच्चा, ये क्या हो रहा है तुम्हारा? अच्छा, सुबह से तुमने कुछ खाया? अच्छा, स्कूल की पढ़ाई कर रहे हो ना? ट्यूशन जा रहे हो कि नहीं? अरे, don't be interfering. Second, there are these वेरी गुडी गुडी अंकल आउट ऑफ नोवेयर, 10 साल से कभी देखा ही नहीं बच्चे इस अंकल को, सडनली पता नहीं कहाँ से प्रकट हो गए और अब दिखा रहे कि नहीं नहीं आप ये जो खाना है ना इधर रखो, वो प्लेट उधर रखो, वो सोफा इधर शिफ्ट करो. अरे तू कौन है भाई? And suddenly, don't be somebody like today I am here. Don't worry, I am going to be there with you. Don't worry if your mother passed away. मैं तुम्हारी मासी हूँ ना जिंदगी भर. 2 दिन के बाद जो मेरे घर में मेरा बच्चा मुझे बुला रहा है. So don't make all these false assumptions and tell people that don't do this. This is only in our culture that we can relevant. It's relevant to us. Don't offer unrealistic solutions like I am there for you. So what if your mother died? I am there for you all your life. Don't do that, because after some time the child will realize that you make unintended promises. Stay sensitive, focused, and attentive to the adolescent. Speak less yourself. Be calm. So this allows the child to mirror, or the adolescent to mirror. He can सामने देख के he absorbs your calmness, he absorbs your stoicity. Speak only when is necessary. बहुत ज़्यादा बड़बड़ मत करो. क्या हो रहा है आज? ठीक है, don't worry. Be calm. So child feels that sense of calm around. This is just some theory that I have to show some slides. Pediatrician's role, this is all in the theory, you can read it up. Early detection, psychoeducation, creating safe spaces, referral and collaboration. Of course, establish rapport and safety, normalizing grief, validating language, okay to feel sad, angry or confused. I said something from my more practical experience considering our socio-economic, socio-cultural situation, but nothing wrong with doing this. Address holistically, and I am very sure, very important, family coping mechanisms, and especially look at complicated grief or clinical depression, especially if the child already had that earlier, or if the bereavement happened 6 months back, still the child is showing that. Support the family unit, recognize red flags, and refer when needed, integrate cultural. But what I am going to say is, remember that this child is now very, very vulnerable. And this child himself and herself is at risk of suicide or self harm. So, subtle unexpected changes may, or psychosomatic issues which have suddenly come up, this may be a clue to you that social, and then the child stops meeting friends, stops going to school, doesn't want to meet others. That leads to a secondary problem of social isolation and a feeling of helplessness. So, these are signs that we should be alert about. And softly spoken statements, I don't want to be a burden on you, or no one really cares, they may be the harbinger of the red flag of something worse, that now this child is really devastated and going somewhere down the road in a bad way. So it's not only about alleviating distress, it's about guiding them towards resilience and growth, safe spaces, communication, integrating families, and navigating loss, but empowering them to come out with a sense of purpose and hope. So these are the things that we have to remember. And see, there's a very nice, all these examples that we can recollect and remember are very nice and practical. The more you deal with these cases, the more you will be able to sensitively deal with it. So I was just thinking about this very nice share again by Ghalib. He says कि ये कहाँ की दोस्ती है, ये कहाँ की दोस्ती है कि बने हैं दोस्त नासे. नासे इज एडवाइजर. अरे ये मत करो, अरे ये करें, एडवाइजर. ये कहाँ की दोस्ती है? आई डोंट वांट फ्रेंड्स हु आर एडवाइजर्स. ये कहाँ की दोस्ती है कि बने हैं दोस्त नासे, कोई चारा साज होता, कोई गम गुसाज होता. I just want somebody who shares my pain, who sits with me and is calm and quiet, and I know that he shares my pain. So ये कहाँ की दोस्ती है कि बने दोस्त काउंसलर्स, कोई चारा साज होता, कोई गम गुसाज होता. Now I'm going to give you some references and so please take out your smartphones and feel free to take photographs, because this is a QR code on which you will get hundreds of such videos and podcasts, and you can download them. They're all free. You can put your own name on it. You can share it with your patients. So that's a QR code. Take a photograph. Later on, you can scan it.
तो वो सीरीज वाइज रिपीटेटिव वो कर रहा था, वही काम.
Now, this was a podcast which I did with Raj Shamani, which is hardly about 48 hours old, and this was yesterday, which had already crossed 1.5 million views. All of that will be available on this. Then there is this new series we have started for all pediatricians called Smart Pediatrician, which are talking to pediatricians about how do you deal with financial issues, how do you deal with AI. And this 1 minute wisdom, again, it's available on these QR code. You can take a photograph. There's an article I wrote about suicide when the Outlook magazine asked me to write this article last year on World Suicide Prevention Day. And again, that's a QR code. But all of this is possible only when we have a team that not only supports us, but actually stimulates us. And this is my wonderful team. And I feel being inclusive is not some merbani you're doing on others. You're doing it on yourself because that is the best tonic for your own neuroplasticity. So acknowledging my team, finally, which movie and which song? Immediate answer. Very good. And song?
रोते हुए
As a pediatrician, when you get a labor call, कि अभी बच्चा डिलीवर होने वाला है and you are running in your rushing in your car, what is it that you are praying for? कि बच्चा रोते हुए आए. मगर अगर आप सही समय पे वहां पहुंचे और उसके बाद वो बच्चा आपका पेशेंट और आप उसके पीडियाट्रिशियन बने, तो फिर ये आपका कर्तव्य है कि आप ऐसा कुछ करो कि वो जिंदगी भर न रोए. और वो पीडियाट्रिशियन अपना दायित्व निभा रहा है जो ये देखे कि कोई भी बच्चा जिंदगी भर न रोए, रोते हुए आए सही मगर हंसता हुआ जाए. वो पीडियाट्रिशियन भी हंसता हुआ जाएगा और क्या कहलाएगा? वो पीडियाट्रिशियन मुकद्दर का सिकंदर कहलाएगा. तो ये आप सबको मुकद्दर का सिकंदर बनना है और उसके लिए आईपी को एक निश्चय करना है, एक एम करना है कि वी विल work with all the members of parliament, everybody else, and finally go right up to the great man in Delhi himself, Modi ji, and request or plead or demand that there should be a separate ministry of children and adolescents. Thank you very much for a very patient listening. Thank you.